Dr. Chhavi, can you please turn on your camera?
Yeah, it's on. Yeah, it's on.
Yeah, ma'am. I'm able to spotlight you once.
Thank you.
Good evening, everyone. Good evening, ma'am. Over to you, ma'am. I can take it over from here.
Thank you very much, Neha. And I'm extremely happy that today we're going to talk about a very important aspect of which we hear all the time, which is blood pressure. I know that I talk to you guys weekly and we talk about diabetes all the time, but really diabetes and blood pressure seem to be Batman and Robin. That means कि वो साथ साथ होते हैं and they are mostly existing as comorbidities together. आप सब लोगों में जिनमें डायबिटीज है which have type 2 diabetes, वेरी हाई चांस कि उनके संग ब्लड प्रेशर भी है और वो परेशान है कि ब्लड प्रेशर को देखें या डायबिटीज को देखें, which one should they see? So today we bring for you, and this whole series which has been very detailed and intrinsically planned ताकि we touch all the important aspects of blood pressure management. क्यों होता है? Why does it happen? How can we work towards it? And how can we truly get ourselves to understand that though we can have them together, we can very beautifully work with lifestyle on each of them, and they together will be benefited by our lifestyle choices that we make. So today I'm thrilled to welcome our distinguished guest, who besides being a brilliant interventional cardiologist, is one of the kindest doctors I know. And after his name is Dr. Naveen Chandra, and he is the head of the department, interventional cardiologist at Astor Hospital. He earned his MD in medicine from KMC Manipal, and then did his DM cardiology from a very prestigious institute in Kolkata. His skills extend beyond just coronary artery interventions, and they include advanced expertise in AIDC and pacemaker placement. I mean, I can go on and on about Dr. Naveen, but he also is very good with cardiological imaging, which is the radiological aspect of cardiology study. He's passionate, which and that is why we work together with a lot of patients, because he's a passionate advocate for preventive cardiology and actively engages in community outreach. He does many CPR training programs, health talks, and heart disease prevention programs. He has numerous research articles published in national and international journals, and he contributes to easily 6 new publications every year. Renowned not only for his scientific excellence, but also for his deep empathy. He's known for providing detailed explanations to all his patients, and we are honored to have a dedicated, compassionate, and professional cardiologist join us. Welcome, Dr. Naveen, and it is my pleasure to have you here for Sugar Fit audience.
Thank you, ma'am. I think it's a pleasure to be here also, to be among all of you in such an important day to discuss and contribute whatever way possible to the community.
Thank you so much. So without much ado, I have very simple yet very interesting questions planned for you. And just for everybody to know that this is absolutely extempore. I have not talked to Naveen about any questions. He has no idea what I'm going to bombard him with. But you know what? I know that he will speak from knowledge and from the depth of human understanding. And I think that is where it connects to all of you. So please listen. And I'm sure this next 30 minutes will be full of great value for your day-to-day life. So let me start, Dr. Mee. I want to ask you risk factors for developing hypertension. Is diabetes one of them?
Yeah, I think that is probably as you said, Batman and Robin. I think most of the patients, some point in their life when they're diabetic, do tend to develop some degree of hypertension. Maybe some people do develop it stage 3, 4, 2, or some maybe in pre-hypertensive. But I think almost, I would say more than majority, more than 70 to 80% will develop hypertension in some point of time. So I think that's the reason that we try to, over invest. I mean, in the sense that we keep a very close watch and close surveillance on such people, and also our threshold to treat is much lesser in diabetes, because these two risk factors, when it is it doesn't become additive, it becomes compounding. So I think that's the reason we need to act fast and act more aggressively than a non-diabetic would. So I think this is one of the most common risk factors is, of course, diabetes. Of course, there are other risk factors as well. It's not that only diabetes causes, but I think if you consider association, this is the commonest association we see in our day-to-day clinical practice, I believe.
I would also want you to sort of list for the other risk factors for the other.
I think one of the, you can broadly divide as modifiable and non-modifiable. Modifiable is something which we can modify, like that is where we have a control over. There is non-modifiable. Now, let's come to non-modifiable. Probably the commonest risk factor for developing hypertension is age. I think as we grow older, definitely everybody tend to become diabetic. After the age of 70 to 80, I think majority of the people will be hypertensive. I'm sorry. So the age remains one of the most important risk factor for developing hypertension, which is non-modifiable. If you grow old, you do hypertensive, become hypertensive, and you treat it. There's nothing to be worried about. And second, non-modifiable, men in general may have a higher tendency to be hypertensive, especially in younger. But I think there are, when we become older, I think that trend may not really exist. At very extreme ages, we see women tend to have a little more hypertension than third is genetic. This is one of the commonest risk factor. A lot of people tend to be in denial when they develop hypertension at the age of 30 or 40 because, I will change. But there are certain things which are beyond our control. If your father and mother are hypertensive, especially at a younger age, if they have developed hypertension within the age of 30 or 40, the likelihood of a person developing a hypertension is quite common. So I think those are the people we also ask them to be much more vigilant about hypertension and keep checking their blood pressure. These are some of the non-modifiable risk factors. Non-modifiable risk factors. Modifiable are one of the, hypertension is the commonest. Second, obesity, physical inactivity. I think one of the commonest cause why hypertension has become so more rampant in our day-to-day clinical practice now. Third is stress. And there are other causes, like a secondary causes, what we call, which are secondary to some other reasons, like renal diseases, renal vascular diseases, thyroid, endocrine diseases. There are so many things. It forms a very small subgroup of hypertension, I would say. These are the in general. So a diabetic, obese, physically inactive guy who has something called a metabolic syndrome, what we call medically, are at a higher risk of developing hypertension compared to the person who doesn't have any one of these.
So I'll take a liberty and just sort of for our Hindi speaking viewers, we have lot. I'm going to just summarize जो Dr. Naveen ने बोला है.
हिंदी में बात करेंगे, कोई प्रॉब्लम
नहीं, I'll just summarize it in Hindi quickly for whatever. So सबसे वो कहना चाह रहे हैं कि सबसे ज़्यादा diabetes is a very big risk factor. उसमें बहुत ज़्यादा blood pressure होने के chances होते हैं. और उन्होंने बोला कि कुछ factors हम modify नहीं कर सकते, बदल नहीं सकते. ये जेनेटिक हो सकते हैं, ये the non-modifiable risk factors are risk factors जो younger age groups में हो जाते हैं 30-40, जिनके पेरेंट्स को अर्ली ब्लड प्रेशर होता है, और कई किडनी इश्यूज में भी होता है जिसमें सिस्ट होती हैं, कई ऐसे होते हैं जिसके अंदर हम मेहनत करेंगे तब भी चांसेस कम है कि हम ब्लड प्रेशर को करेक्ट कर पाएंगे. पर और मॉडिफाइबल जो होते हैं वो कई तरह के होते हैं, स्पेशली वेट गेन, और अगर आप डायबिटीज़ भी रिवर्स करते हैं तो बीपी कम हो जाता है, और वेट लॉस बहुत बड़ा फैक्टर होता है बीपी को कम करने के लिए. स्ट्रेस, एंजाइटी, स्लीप, ये चीज़ें अगर आप मॉडिफाई कर सकें तो आपका ब्लड प्रेशर कम हो सकता है. तो आई थिंक दैट इज़ व्हाट वी हैव टॉक्ड इन द रिस्क. सो माय नेक्स्ट क्वेश्चन इज़ कि everybody knows ki systolic and diastolic, and systolic is the bigger, higher number, and the diastolic is the lower number. I want to ask you, what do they represent from the heart pumping? What is the jet, and which one is more important? Because I keep getting this question: ki, is the systolic more important or diastolic more important? So I would like you to sort of.
I think in general, there are two blood pressures we call systolic, which is the upper one, and the diastolic, which is the lower one. Now, if you ask me, which is the more there were a concept of diastolic being more important in a younger patients, and systolic being a much more important blood pressure to treat in an older patient, because they are more correlated with stroke, vascular events, etc. But I think both are now the current understanding would be to treat both hypertension equally. But if you see in younger patients, usually a diastolic hypertension is more common. जो नीचे वाला blood pressure होता है थोड़ा ज्यादा रहता है उनको. In older people, they will have much more of a systolic hypertension because of the arterial stiffness. The artery becomes much more stiffer, so the systolic blood pressure remains to be on the higher side in especially older population, more than 60. If you see 70, 80, their diastolic is very, very low. What we call as a pulse pressure becomes extremely high. So everybody is worried, like, मेरा diastolic बहुत low जा रहा है, मैं क्या करूँ? Systolic तो it's always how do we treat it? It's very difficult to treat. It's a challenge all the time. So if you ask me, both are important. Both has to be given due respect when we treat, and there is a target for both. तो systolic जो होता है वो 120 से कम होना चाहिए, diastolic होता है 180 से कम होना चाहिए, उसको हम ideal बोलते हैं. At least 140/90 से कम होना चाहिए. That is the ideal limit. Let's say you achieve a diastolic of more than 80, आप systolic 150/160 में ही है. That is not called good hypertension. Systolic has some when the systolic hypertension is there, there is a lot more chances of patients getting stroke and hemorrhages and other vascular events. Diastolic में क्या होता है, heart में बहुत ज़्यादा pressure बढ़ता है because it is the resistance increases, so heart failure के chances रहता है. But both of the component has some dealing with other. But if you see most of the younger patients, they will have diastolic or it's a mixed hypertension where systolic or diastolic both will be high. But in elderly, it is isolated systolic. It's always isolated systolic, where diastolic is always less than 80 and the systolic is mostly more than 140. It possesses a unique challenge in treatment. Of course, we'll come to that. I think if you ask me, both are important. Both has to be got down to the ideal limits.
Is the BP in a diabetic? So if you have a diabetes patient, what would be your strict range for them? How would
we are much more stringent. For a non-diabetic, we would say 140/90 is acceptable, not ideal.
Yes.
Less than 130/85 is lower than normal, what we call, and less than 120/80 is ideal. In a diabetic and a kidney disease patient, these are the patients we always try to be ideal, not acceptable. So in a diabetic, we always try to get it to 120/80.
So I want to repeat this to all our audiences. आपका blood pressure 120/80 से कम होना जरूरी है. 140/90 ठीक नहीं है आप लोगों के लिए, who are diabetic. 130/85 ठीक नहीं है. Dr. Naveen is very clear, and I also talk to you all the time. Blood pressure आपकी body में complications नहीं हो, kidneys safe रहें, उसके लिए 120/80 होना जरूरी है for diabetes patients. Thank you. So I was going to ask, is there a gender-wise anything with gender? As you said, women as they get older tend to get BP. Why is that so? Is there a reason for it, or can you elaborate a bit more on the gender-wise distribution of blood pressure?
Gender-wise distribution, when we say younger patients, is always women tend to have a much lower blood pressure premenopausal. There's a lot of hormonal protection they get. आप उसको देखेंगे तो diabetes भी कम रहता है. Heart diseases are very, very, very rare. Of course, it is on the inclination now, but otherwise premenopausal age में heart disease भी बहुत कम रहता है. So they do have some hormonal protection against these metabolic diseases, what we call. But men generally have a higher blood pressure. They start hypertension much earlier. Women, of course, people who have peripartum, pregnancy-induced hypertension or a strong family history of hypertension do develop hypertension. But nowadays we see, because of the urbanization, lot of stress and strain, I do at least see at least 5 to 10 hypertensives in a week woman, young girls, young young office-going girls. I see a lot of patients who has pre-hypertension or stage 1 hypertension nowadays, which the trend is definitely changing, you know. And as we grow older, the arterial stiffness increases. Although it's in cardiac, जो बोलते हैं हम, women have much more, have a protection against most of these cardiovascular diseases, cardiac या vascular, वो जो premenopausal बोलते हैं. Postmenopausal, it more or less equal. But in hypertension, actually, when they grow older, they may have much more chances of getting hypertension than men. But in a woman, the problem is that any heart disease or hypertension, the complications are much higher than a man. So especially in the extremes of the age, when they do develop, even in a heart diseases, heart problems, they usually tend to do worse than men. Although the incidence is lower, the severity is much higher. So that again, another thing is that hypertension in women is always overlooked.
Overlooked, yes.
Husband and wife साथ में हम आएंगे ना, they बोलते हैं सर आप पहले मेरे husband को देख लीजिए.
Biggest issue, even in diabetes, Dr. Naveen, same thing.
So they will insist me to see on them, and insist our majority of our discussion उनके ऊपर ही चलता है. And it is a fact actually, in the sense that although heart diseases are equal, hypertension, diabetes are equal after the age of menopause, presentation of a man to a clinic is much higher than women. It is not the incidence. It is just that they don't go there. They take it always second in a family to a man.
Yes, second.
There is a social angle to this. It's not only a medical angle.
This is very, very relevant to India. So I would like to tell कि anybody above the age of 50 female, आप प्लीज अपना ध्यान रखें और आप अपने ब्लड प्रेशर को एटलीस्ट, मैं कहती हूँ सब लोगों को अपने घर में एक इंस्ट्रूमेंट आजकल सबके पास होने लगा है. संडे मॉर्निंग एज अ फैमिली एक टाइम बनाएं और अपना एक ब्लड प्रेशर रिकॉर्डिंग बैठ के इन अ डाइनिंग टेबल प्रॉपर करके आप एक अपना बीपी वंस अ वीक अगर निगाह रखेंगे तो वो बिफोर कॉम्प्लिकेशन. सो माय नेक्स्ट क्वेश्चन हियर इज Dr. Naveen, what kind of complications and the effect of blood pressure on our vital organs of the body? So, आप please वो list करें. How does hypertension affect?
Complications are plenty. One very important thing is that usually hypertension अकेले नहीं आता है. Okay, hypertension comes with other diseases also. Sugar, diabetes, cholesterol, obesity, ये जो बहुत सारा चीज साथ में आता है. तो isolated hypertension बहुत कम देखते हैं, especially after the age of 50-60. It doesn't come isolatedly. There is other diseases, so screening of other diseases becomes important. The most common complication जो होता है cardiovascular diseases, जो बोलते हैं heart का या vascular, means attacks, strokes, and other vascular diseases. Second is kidney diseases. Kidney diseases are very common in an uncontrolled hypertension. जो kidney failure जो होता है, protein loss in the kidneys, etc., bleeding, eye problems, eye hemorrhages, loss of vision. There are multiple. Basically, it is cardiovascular. So over a period of time, ये जो pressure ज़्यादा होने से the vessels जो artery होते हैं, which may be eyes, brain, kidney, heart, lung, anywhere, they start getting weaker, and they can clot, they can rupture, they can cause bleeding, etc. But hypertension has a very specific prediction and correlation with stroke. Stroke chances, especially bleed, and the stroke chances are very high in hypertension. So that is one thing which is one of the commonest complications जो बोलते हैं. Second is of course cardiac complications all occurs. And another thing what you understand is that they are all comes in together. All this, as I said, it is not 1 + 1 is 3.
Yes, yes.
It's not 3. 1 + 1 is 10. It becomes.
Yes.
तो जो साथ में जो आते हैं वो complication बहुत ज़्यादा create करते हैं.
Thank you. One very important discussion I would like you to do with our audiences today is the importance of weight loss and the percentage of obese people that get blood pressure. क्यों होता है obese लोगों में blood pressure? Why does it happen? And why is it very important? Dr. Naveen, I face this all the time in our sugar fit population. मेरा ज़्यादा weight loss हो गया, लोग मुझे पतला कहने लगे हैं, मेरे को आप इतना weight loss करा रहे हो, हाँ मेरे blood pressure की गोली बंद हो गई है, मेरी डायबिटीज की टैबलेट बंद हो गई, बट मेरा वेट लॉस हो रहा है, मुझे लोग कह रहे हैं. So there is so much resistance to lose the fat. So I explain a lot about fat loss and muscle loss. आप थोड़ा सा please stress on.
Yeah, I think this is a very, very common problem. Even I have faced this. You know, there was one time when I was in a very big weight loss spree. I could not attend a function. Now, people would talk to my wife, so talk to everyone. What is happening to him? Is there something wrong with him?
Yes, this is India.
It's very sad. Then, because of all those things, actually, in fact, you know, I would tell that, you know, I was doubting myself whether I'm doing right or wrong, being a doctor.
Yes, yes.
It's a very common problem, and I've realized that one thing I would understand is that 90% of Indians are overweight. ये
Yes.
normal नहीं है जो हम हैं,
बिल्कुल.
including me. Madam is very fit. It is we are not normal. Absolutely normal. Unfortunately, there is something called thrifty genotype बोलते हैं. उससे हम we
Yeah.
predominantly start accumulating fat
Yes.
in the abdominal region.
Abdominal.
Right. If you see most of the Westerners, Caucasians, जो भी होते हैं, we have a pelvic fat, etc. But as an Indians and Southeast Asian, हम बहुत ज़्यादा abdominal fat. Even the पतले से पतले लोग को पेट रहता है.
पेट रहता है.
So nobody is fit. So we understand nobody in so over a period of time we have taken this as a norm, which is not the norm.
Yes.
And I think I personally
Weight loss.
there is nothing which works better than this because it is a culmination of all the other things what you do in life.
Thank you very much. I think.
Hypertension, I tell them, there are people who come to me in my clinic. मैं खाना कम कर रहा हूँ, मैं walking कर रहा हूँ, मैं सब कर रहा हूँ, क्यों नहीं कम हो रहा है? Unless and until you start losing weight, you will not see the clinical benefit. Somehow I have seen it.
Yes.
And a kilogram of weight loss has shown to reduce your BP by 1 to 2 millimeters of mercury. There are some studies to show 2 millimeters. There are some studies to show 1 millimeter. So let's say you lose around 5 to 7 kilograms, which will reduce your blood pressure by maybe a 5 to 10. If you're lucky, it may reduce by 10 millimeters, which is equivalent to an amlodipine dose.
Very good. Thank you so much. This is just amazing. I hope everybody is focusing on this. These are golden words. And
if you want to be off medicine, people come in the clinic and say that मुझे medicine that's the only, I think it helps with diabetes also. Madam can very well tell you how it helps your diabetes. If you want to reverse hypertension, it is only the weight loss. There are people who are very thin who develop hypertension. There are other reasons for it.
yes.
Those are unfortunate guys. They are a very small subgroup of people.
Yes.
The largest subgroup of people are obese.
Yeah.
People will tell thousands of things, but I don't think you should worry. Absolutely not to worry. Even if you lose 10, 15 kilos, it is no offense. There is nothing. The subjective feeling, the well-being what you have, I've been there. I've been in a BMI of 21, 22 in the past. The subjective well-being what you feel is unmeasurable.
Unmeasurable. Very, very true.
You can see blood pressures, you know, see, there are certain things which are beyond your control. Sometimes you lose weight, you still, diabetes may not be able to control, hypertension still may not control. There are certain things which beyond your control, but I think 80 to 70% you should be able to control. And also it's not only that, if not, you're not able to completely off, at least it will reduce your dependency on medicines. 1, 2, other risk factors. It will
risk factors.
Risk factors.
Yes, complications, right?
And another thing about weight loss and exercise, people underestimate is a psychological event what it will have on you.
Endorphins, yeah.
The amount of endorphins, amount of well-being what you feel, it is. I usually run actually. The reason I run is just to have a mental well-being, not a physical well-being at all. People keep telling me, oh, you want to run. Actually, it gives you so much of a mental well-being. It is unmeasurable. So that helps in improving your diabetes. That helps in improving your hypertension. You know, that, as Madam said, weight loss is the single most after salt, of course, salt is the number one. Single most, and every studies have shown irrefutable, and it cannot be contested by anyone. If anybody says that I've lost 5 kilos and my blood pressure has not come down, it is invariably there.
And it is the same thing for diabetes, doctor.
Absolutely, absolutely. The amount of people. Only thing is that sustainability is issue.
Yes.
Sustainability is the key, and sustainability is something you have to work on, and it has to be very gradual. It's a planned one. It's not like.
And that is why at our program, Dr. Naveen, the way we have done it is very, very slow, because we want people to deepen their one habit that they achieve. If suppose early dinner, one habit has to be mastered. Then you stack the second habit, because you have to master, and you should know that these are the 6 habits that I need to live my life with in a daily discipline. If I do 5 very good, if I do 4 very good, but I should not be losing my habits. And this is giving them key of simple daily habits that completely change you as a person. Your lifestyle disorder is what we do. So another question I have is, how important do you, just like I mentioned, every Sunday, me and my husband always check our BP around 10 o'clock on Sunday. We're very relaxed, but both of us check our blood pressure every week. We don't have blood pressure, we are healthy, but in case as we get older, as you said, age, and we don't want to have a problem and not know it, what do you say about self-monitoring of blood BP, and also reflect a little bit on what is ambulatory BP monitoring, and wo kya hai, people don't even know about it. So I would want you to talk about BP.
Self-monitoring of the blood pressure is extremely important. And what happens is that it's very important for us to control the blood pressure. To monitor the blood pressure, because as blood pressure, diabetes, they're all silent killers, because you wouldn't have symptoms. People will come with a 200 blood pressure with no symptoms. Suddenly they'll end up in an emergency. I've seen my blood pressure 200. I don't know what to do. There will be absolutely no symptoms. So most of the people with hypertension may not have any symptoms. Very minor people of the symptom may have some headache, some giddiness, not very classical. Majority of them land up in complications.
Yes.
This is why we need to, monitor our blood pressure much regularly. The guidelines say there is absolutely normal once in 6 to 1 year. But if you see, the thing is, people spend money for all nonsense things. Spending 1,000 or 2,000 rupees for a blood pressure machine is absolutely, it is really non-brainer, no-brainer actually. It is available so freely, so open, and people do come and ask me whether it is reliable. Should I have an electronic blood pressure machine? Is it reliable or not? See, it is absolutely reliable. There is a 5 to 10 millimeter difference that side, this side. That will always be there. There are guidelines that you can check upon, which are validated machines. There are websites to say there are certifying authorities. There are certain machines which are validated, well validated. They are in the market. They have a 5 to 10 millimeters of difference. It will give you a fairly good values. But because they are not validated, because they are not very accurate, I will not buy, I will not measure is a wrong thing. Something is always better than nothing. How much time, how effort it will take for you to go to.
No, you put it in your routine every Sunday, 10 a.m., something.
It is a must for everybody to have it at home. Anybody who is around more than 40 or 50, they should have a blood pressure once in a while. Definitely, it's a very good this one to keep checking your blood pressure. That also helps in picking up pre-hypertension, where you can very aggressively go and treat and go very aggressively on treatment of the protocol. So I think, as Madam said, it's very important to monitor it. And blood pressure, let me be very this one. There are hospitals which use electronic machines. Okay, they are very well validated. There are companies which are very well validated.
Yes.
So you can't have a mercury manometer everywhere. It's not easy. And mercury manometers are not even there in the hospital. Okay. Now the aneroids, and there are aneroid and electronic. They are mixed. This one you are getting. They are very well. They are very fairly accurate. My parents use it, so I think it is very accurate. The second question about ambulatory BP monitoring. See, blood pressure is a very dynamic thing. Now you check the blood pressure now, and after 5 minutes, there will be a difference of 5 to 10. There are sometimes people come and sit in the chamber. There is something called white coat hypertension. जब आप डॉक्टर साहब के चेंबर में जाएंगे तो ब्लड प्रेशर ज्यादा ही बढ़ जाएगा, थोड़ा एंजाइटी रहेगा. So we invariably, if you see the diagnosis of hypertension in an ambulatory BP monitoring and hypertension in a clinic is different. तो clinic में 10-15 ज्यादा ही रहता है, but कभी कभी 180, 170, 160 सब आता है, but it may not be a true representative of your own blood pressure.
Yes.
Do come and tell मैं बहुत anxious हूँ. So if I take that blood pressure and start treating you, your blood pressure will fall down when you go home. And there are certain conditions where थोड़ा blood pressure बहुत brittle हो जाता है, सुबह रात को ज्यादा हो जाता है. So we put something called an ambulatory BP monitoring. Every hour आपको एक blood pressure machine ये करते हैं, या आप घर में ही कर सकते हैं, ऐसा नहीं कि हॉस्पिटल में रहना पड़ता है. So it will check your blood pressures every hour. Every hour when it checks, it will give you a representative of 24 hours. Now 24 hours में 120/80 is a high. In a hospital, 130, 140, 90 is hypertension. In a 24-hour, 130/80 is also hypertension. And रात में जब आप सोते हैं, there has to be something called a nocturnal dip.
Nocturnal, yes.
10 से 20 मिलीमीटर तक तो ब्लड प्रेशर कम होना चाहिए. Night more than 110/70 is hypertension.
Absolutely.
तो ये जो nocturnal dip नहीं रहेगा ना, that is another earliest sign of blood pressure. So there are so many information. So हम जब doubt होता है, देखिए एक हाइपरटेंशन आ गया 140/90 से है तो ठीक है, उनको हम एम्बुलेटरी बीपी नहीं करते हैं, देन वी स्टार्ट ऑन मेडिसिन. डाउट में रहते हैं प्री हाइपरटेंशन है कि नहीं, हाइपरटेंशन है कि नहीं, शैल आई गिव हिम जस्ट लाइफस्टाइल चेंजेस और शुड आई गिव हिम टैबलेट्स और नॉट. इन लोगों में हम एम्बुलेटरी बीपी मॉनिटरिंग करते हैं टू डिसाइड वेदर शुड आई स्टार्ट ऑन मेडिसिन और नॉट. ओके, सो इन सच इंडिविजुअल्स more often we start on not. I mean, when we start doing 24 hours, we see the trend now. It's always on the higher side. So people who are on denial.
Yeah.
Okay. They want
exactly. बहुत सारे पेशेंट्स हमारे पास आते हैं डॉक्टर नवीन, वो कहते हैं आदत पड़ जाएगी, एडिक्शन हो जाएगा दवाइयों का, हमें आप क्यों दे रहे हो ये दवाई. तो आई एक्सप्लेन टू देम दैट द ब्लड प्रेशर केम बिफोर द मेडिसिन, नॉट द मेडिसिन बिफोर द ब्लड प्रेशर. तो आई ट्राई टू एक्सप्लेन टू देम, आप क्या कहना चाहोगे फॉर दीज थॉट प्रोसेस इन आवर कंट्री व्हिच इज वेरी प्रेवलेंट.
very difficult, sitting in the clinic and convincing people is very difficult.
Very difficult.
Especially about that of cholesterol and hypertensive medicines. देखिए आदत definitely पड़ जाएगी. पढ़ सकता है, and if you want to very driven to reduce it, to stop it, I told you, do weight loss, do aggressive lifestyle and follow that for your entire lifetime. I'm okay with that. It is seldom possible. There is whatever lifestyle जो changes कर रहे हैं, it has to be practical.
Yeah, exactly.
You stop everything, don't eat anything, eat grass, drink water and stay, your blood pressure will come down. Of course it will come down. See, this is what happens in most of this so-called curing diabetes and things where you go to stay in 15 days. They don't give you any food.
Yes.
The blood pressure will drop. Of course it will drop.
Enemas, detoxification.
I mean, you don't give 0 calorie for a person.
Yes.
Of course blood pressure will going to drop.
Of course, yeah.
And when you go home, can you do that? No, you can't.
Oh,
So
exactly.
when I see that side effects of the medications, see, these are all new medications. These are all very advanced medications, studied with humans, studied with for a long period of time. Most of the medications what we use for hypertension are in the market, are in the human domain for more than 50 years, 60 years, 20 years, 30 years. Nothing what we write is less than 20 years or 10 years. So they are very well safely documented. And the side effect of those medicines are much lesser than side effect what you're going to have with the blood pressure.
Blood pressure.
So it's all about risk versus benefit.
Yes.
If you cross the road, there is always a risk of somebody hitting you and dying there. But it doesn't mean that we don't cross the road and go to work. It's a risk versus benefit we take. Same thing. I mean, I think it's fair enough. But I think adat pad jayenge, that is not an excuse for not taking it. But a lot of patients who are driven to do anything, we do have, it's a small percentage, of course.
Yeah.
They take medicine, they do a good lifestyle, they come down, they're made.
Take away the medicine.
There are a lot of examples actually.
Yeah.
There are a lot of examples, but yeah, sustainability, see, दोनों चीज साथ में नहीं हो सकती.
Yeah, very, thank you. Yeah, bilkul. So there are people who can stop their medicines also if they were to lose their weight and sustainably lose their weight properly, not extreme
See, I don't think as a doctor, we don't ever ask that you should be on medicines or not.
Yeah,
You ask things to be controlled. You are on medicine, not on medicine, who cares?
who cares?
You
Yes,
get your
blood
blood pressure
pressure,
normal. Who are
complications.
we to give you medicine? We won't give you medicines.
My one final question before I'll ask Neha to pick up a couple of questions from the audience is, what kind of exercise would you advise for a patient who has blood pressure to improvise the BP? There are now a lot of studies coming out. So just reflecting on this last question before
So
Neha
I think exercise. Uh, Let me be very practical and pragmatic here. The most of the people will come, sir, I will start joining gym from tomorrow. It's not required. Actually speaking, the simplest walking is actually more than sufficient. A simple aerobic brisk walking. You need to have a brisk walking. It's not that you just walk leisurely or something. Brisk walking means around 2.5 to 3 kilometers you cover in half an hour. That is called brisk walking. You sweat when you do that. You raise your heart rate. This brisk walking, you maintain around 150 to 300 minutes per week is actually more than sufficient to have. The exercise always has a J curve. Now, once you went up till 150, 300 minutes, this one of a moderate intensity exercise, when you do, you get the maximum benefit. Let's say you go to a very high intensity run and it may not show you that much of a high, this one, but of course it will help you in losing weight and all those things. If you consider aerobic, I think 150 to 300 minutes of walk, run, jog, cycling, swimming, whatever is sufficient to have a very good result. But having said that, at least once or twice a week, we have to do some resistance training, strength training, okay, and because as we exercise and we diet, there is a tendency to lose muscle mass as well as along with fat.
Yes, yes.
That's one thing we always discount the fact that hum weight loss karenge, I don't know how much of a muscle mass we lose. So when you walk or run, you're going to put your muscles, you're going to stimulate your calf and thigh and all those things. But your upper limb muscles are not going to be stimulated. So we have to make sure that at least 2 to 3 times a week, you stimulate every muscle on your body. Every muscle in the body. You don't need to go to gym to,
No, you just need a TheraBand in the house.
Push-ups, 5-6 push-ups, squats.
Yes.
If you are good enough, do 1 or 2 pull-ups, because that is going to stimulate every part of your muscle. The body weight is more than sufficient to do all the strength training and the weights of your
some resistant bands are very good.
So resistant bands are there. And if
Very
you're old, you do some balancing exercises.
Yes, balancing. Right.
So, that is what you require. You don't need to go to gym. You don't need any fancy equipment. I don't think anything is required. But yoga, of course, yoga helps a lot in hypertension, etc. But I think physical exercise is a must. Yoga is not an alternative for your exercise. It is always an add-on.
Yes.
You need to burn your calories. Very simple and straight point. You need to burn your calories. You need to burn more than what you consume if you want to lose weight. It's as simple. And if you are in ideal weight, you have to equal it.
Very good.
Cardio is must. The conceptually, I think people are going towards a little bit of strengthening and little bit of weights and HIIT also. There are suggestions that, intermittent fast training. जब आप walking करते हैं half an hour, आप थोड़ा 5 मिनट बहुत fast walk कीजिए और just do a small jog. The 10 minutes slow हो जाइए, थोड़ा fast walk कीजिए, दो हो जाए. That is a very, very good exercise for heart.
Yes.
You raise your heart rate and it helps in controlling your basal heart rate, etc. So those are the certain things which we can do. But I think the first and the foremost thing would be to do.
Yeah, to do. And again, I will stress that along with that, even Dr. Naveen as a cardiologist says कि muscle mass का ख्याल रखिए, बहुत ज़रूरी चीज़ है. As an entire country, I feel as a culture, हमने अपनी muscles को बिल्कुल ignore करा है. हमें अपनी muscles का बहुत ख्याल रखना है. वो बहुत काम करती हैं. They're very useful for so many things. With that, I'll ask Neha to pick up a few questions from the audience, couple of questions only, and then we can close.
Sure, ma'am. So the first question we have in the audience is, can hypertension be reversed like diabetes?
Yeah, it can be reversed. See, it depends on the cause. if your cause of your hypertension is a pure lifestyle related disease,
Quantifiable.
to change, you can reverse it. But see, hypertension is multifactorial. There are certain times there may be diabetes, there may be a genetic component to this, there may be renal issues and all those things. Then you will not be able to reverse it, of course. But if it is a pure lifestyle related disease, obesity, stress, physical inactivity, caloric intake, food is the reason for your hypertension, you correct it. It's a very good possibility of reversing it. Even though if you cannot reverse it, definitely you'll be able to control it better. Definitely you'll be able to reduce your medications on better. See, whether I'm able to reverse it or not should be the least concern. I don't think people should go with the mindset of, okay, I'm going to reverse it. I'm going to do it. I just do it. It happens. If it doesn't happen, it doesn't happen, but it doesn't harm you.
Neha sees me say that every time for diabetes too. आप improve तो कर रहे हो ना, without medicines, lesser medicines, you're feeling young, you're feeling energetic, your immune system is getting better. Just do it. Don't look for just the word reversal.
See, I'm telling you, one thing I'm telling you, it doesn't happen your physicality, or at least it will give you mental peace.
Yes.
The amount of, see, that is, I always see that is what is discounted. And I just came home now. I will just go for a run now. Maybe, it's not for anything. It just, I feel,
Relax. Yeah, it relaxes
yeah,
your mind.
it will give you some sort of a, it's a process. And I don't think you can think about the result and go about the process. I think you have to enjoy the process, I believe.
Enjoy the process. Yes.
Thank you so much, doctor. Then there is one very important question that people, often get confused in: how to distinguish between the heart pain and the gastric issues. So many times people get confused between these two.
Oh yeah, see, we're going a little off topic. That's all. There's no matter. But I'll tell you one thing. Even doctors find it difficult. It's not only the patients. Even sometimes even doctors as we find difficult to differentiate, because the heart diseases have a lot of ways of presentation. There are every day we see new type of presentations. Today I saw a patient where 3 days back they went to a clinic with gastritis, took a gastritis medicine and came. It was found to be an attack. It is difficult. It's very difficult. But what I can tell you is that the most important thing is that something which has never happened in the past, some symptoms, everybody would have had gastritis sometime in their life. Some gastritis or some symptoms which you have never seen in your life, something new. And there is some sort of a heaviness in the chest, not going down with the conventional pantoprazole or something like that, and associated with some giddiness, breathlessness, some chest heaviness, tightness. I think it's worth getting an ECG and doing.
Yeah.
As I said, being doctors, so many times we do miss it because the symptoms, the cardiac pains can come from jaw to umbilicus anywhere. It can be. I've seen people going for physiotherapies for backache. I've seen people going for dentists for dental extractions. So it's difficult, but any unusual things you need to be more careful about.
Thank you so much, sir. I think we have covered almost all the questions. It was such an insightful session, and I'm sure we all have learned a lot today. Thank you, Dr. Naveen and Dr. Chhavi, for joining us today for today's session and helping us in the mission to spread more awareness regarding hypertension and how to deal with it. We are really blessed to have you both here in our life and in today's platform. Thank you so much from the bottom of my heart.
Thank you for calling me. I think it's always a pleasure talking to Dr. Chhavi.
Dr. Naveen, it is my pleasure.
I
And
think it's because I think the amount of work you're doing on a preventive scale is so noble, I would say. So
thank you.
noble, I would say.
Thank you very much. I
It's
have
difficult to motivate people.
cardiologists like you who help my patients do so well, that I'm very, very grateful that I'm surrounded by such brilliant minds and such empathetic souls. I think that is what makes a doctor a true doctor. And I'm very, very happy that I had you over. And I hope, I don't want to take up too much of your time, but maybe more sessions for people, because I think our diabetes population really needs to know about blood pressures, heart disease, complications, various aspects. So Thank you so much for taking out. I know what a busy day you have every single day. You come home and you've taken out that time for us. We are extremely grateful. Thank you very
Thank
much.
you so much.
And then I want to thank all my SugarFit users who have joined, and I'm sure you have benefited today. And I'm grateful that all of you also took out time in the evening. And the next 4 sessions are also brilliant sessions that Neha has planned, and I want all of you to join and understand yourself and your complications better. Thank you. Thank you. Thank you, Dr. Naveen. Thank you very much.
Good night, ma'am.
Thank you,
Good
everyone. Good night. See you
night.
all tomorrow at 12 o'clock. So please do join for second session, which is on the stress. I know there were a lot of questions on the stress, and we will be taking this by another subject expert tomorrow. So do join us. Thank you so much, Dr. Chavi, for your time. And I'm very grateful to you for this session and having Dr. Naveen here because it was not possible without your help. Thanks a lot.
Thank you very much. Bye-bye.
Good evening, everyone. Thank you. See you tomorrow.
Bye.
I just want to remind everyone tomorrow's session is at 12 o'clock in the afternoon. So please do join us.